afternoon, everyone. Thank you all so much for coming to this very special occasion. Before I start, I want to welcome all the board members, senior Piedmont leaders, and a special welcome to Mrs. Clay and the whole Clay family. This is really such an honor to be able to be here to talk to you all. I just wanted to briefly tell you a little bit about our educational program and this clinic. So Piedmont, we were Athens then, decided to set up an educational program many years ago, and we came 7 years ago to start this program. At that time, we knew that we needed a clinic for our residents to practice out of. So we had two main goals. Our first one was to provide a center of excellence for education, and the second one was to be of immediate benefits to the community around us. So with these two laudable goals, we started small. So before our residents came, we decided that Dr. Pip and myself, we were going to start building up our patient panel. We thought it was going to be a very slow process and people wouldn't want to see us. So we started in Oglethorpe, which is our first site. We had 4 patient rooms, 2 physicians, 1 nurse manager, and 1 on their staff. So the first day was quiet. I said, well, maybe they don't like us. And then by the 3rd day, trouble started. We had a patient who called us from the parking lot. We were on the 2nd floor. And he had just been discharged from the hospital after having an amputation. And he said, look people, I tried to get here, I've made it as far as I can, and someone come get me. We realized immediately we didn't even have a wheelchair. It was a struggle. He said, well, I might as well just shoot myself. And we later found out that he was discharged and lived in somebody's backyard on their farm in a little trailer that had 4 steps to get into. And he had been dragging himself up and down, waiting for the appointment to see us. I can't say we did the best we could, but I can say we then realized how deep the need in our community was. So with the help of Piedmont senior leadership, we moved here to our current site. And we were so excited because we went from 4 consulting rooms to 16, and we thought we were the best place in the world. We had only 15 physicians in our first class. But very soon, we realized we needed more space. We have grown over time. First, the hospital helped us. We had a social worker who came half a day a week for these kinds of patients. She was quickly overwhelmed. And now, I'm proud to say, with all the help that the foundation, Tammy and the group, Mr. Smith here, have given us, we've been able to have a full service social worker, we have our own pharmacist, we have a pharmacy buyer, we have multiple members of staff, our MAs, we have a financial counselor. So what are we able to do? So if you walk through those doors, whether you're a banker, whether you're a professor from UGA, or a homeless guy, or the brand new immigrant to this country, you will receive excellent cutting-edge medical care. It doesn't matter. The latest insulin, you don't have to have the ability to pay. We do everything possible because we have staff members who are dedicated to providing this excellent care to our community, regardless of your ethnicity, age, or social background. We all know that only 10% of health is medical. The other majority is from all the social issues that affect healthcare. And Dr. Clay was very passionate about this. So we are so glad today to say that we will use this gift, and it's an amazing gift, to make sure that his legacy will not die. We will use it for education. Let me tell you a little bit about our clinic. So we started as a general medicine clinic, but we quickly realized that that was not enough for our patients. Many of them had skin problems, they needed care. They had eye problems, they needed care. We didn't know what to do. But being that we're very innovative, we decided to ask physicians to volunteer a half day a week. And with the aid of our residents, now my patients here get better care than I do because it's a one-stop shopping. You come here, you're going to see your general intendist, you will see your endocrinologist, you will see your lung doctor, you get your eye care, our financial counselor, all in one spot. How many of you can boast about that? No, with several doctors. So we are providing a stopgap for this community that we need, but we have several needs. You know, for us to be able to provide skincare, our doctors have had to learn how to do skin biopsies and skin procedures. And you know that these young doctors you see, they're very innovative. We created our own abscesses using toothpaste so that the doctors could learn how to drain them. And we do them right here so our patients don't have to wait or go and clog up the ER. So this is the kind of innovation we've been practicing at low cost level. We use pig feet to learn how to do skin biopsies. So we've grown in our services, but we need more. The community need is great. We are only at one site. The east side of Athens has no Piedmont presence. There are patients who come from all over. We have patients coming from Hardwell. They come from all cities around. It's not just here, and we never shut our doors. You see all the smiling faces of our staff and our residents. So we are really grateful for this gift. It is going to go a long way, and it's going to live forever, and I hope we can make you all proud with what we are doing. Now I have one of my seniors. I'm really proud because we are graduating here soon. We've seen 10,000 patient visits already, and we have a panel of more than 4,000 visits. We want to grow this, but I want her to share her example of how, in her learning to be one of the best of the next generation for physicians for Athens, she has also learned how to care for the types of patients that we see. So let me introduce Dr. Huda Al-Bahadili.
Thank you, Dr. Al-Bahadili. Thank you, Dr. Al-Bahadili. I'm very honored to be here with you all. I would like to share with you a glimpse of the great learning experience and the tremendous support we've got from our teachers, our interdisciplinary team, and most importantly, our patients here at the clinic. It started 3 years ago. 3 years ago, I started seeing a very young woman. She came to me and she had this extremely uncontrolled diabetes, very high blood pressures. And her two main concerns were, she's like, Dr. Huda, I don't want to be blind like my aunt, and I don't want to end up on dialysis like my mother. She was terrified. I was overwhelmed. I didn't know what to do with all these numbers that I'm looking at. High blood sugars, high blood pressure. I was just an intern, a first-year resident. So I walked out of the room because we tend to go and talk to our supervisors, and then I walked back and I told her, all I need you to do is to come to your visits on a regular basis. Just come to your follow-up visits and we'll work on this together. And days went by and she actually showed up to her visits on a regular basis. We were able to get her on insulin through our pharmacist and through the medication assistance. And as she saw her numbers and her blood sugars getting more and more controlled, she was more and more motivated. Knowing that, and as we learn on weekly basis and on daily basis, we learn and we know that diabetes is the #1 cause of blindness, we were able to establish her with our own eye clinic. That eye clinic that was actually established by residents. It was a quality improvement project that was set up by residents. We were able to have an ophthalmologist who kindly volunteered his time to have residents actually supervise them to see the patients. And the residents were also excited because they were keen on kind of updating me when they see her in the clinic too. So that was her eye problem. We were also able to monitor her blood work on a regular basis. We got her blood work done, and as we know, a complication of diabetes, it affects the kidneys, and unfortunately her kidneys were also getting worse. So that kind of aggravated the initial fear that she had, that she didn't want to end up on dialysis. So we sent her to our nephrologist, and again she was seen by residents, supervised by our nephrologist who sees patients on a weekly basis. Just looking back at that story, with the help of the interdisciplinary team, including our subspecialists, this patient now has controlled diabetes. I was able to take her off insulin. She now has a controlled blood pressure, and she's a very happy patient. I saw her 3 weeks ago. I said goodbyes to her because I'm leaving, and I transitioned her care to the next primary care physician. I want to say that this is just one story of thousands of stories that our community care clinic has. Clay family, we would like to thank you, and we would like to show you appreciation for the precious gift you've given us. We want to assure you that this gift is going to go a long way to first saving lives and training future doctors for our community. Thank you all for being here. Thank you so much. Very, very